This might be a little bit of a longer one. It might end up being the longest video of the semester. Just didn't feel like there was a good breaking point. Okay, so we're going to talk about chronic responses to altitude. Here are our objectives and outcomes. So we're going to go back to this figure here. This is what we ended with on the acute. Okay, notice, remember, the colors are all off. So again, what do I want you to focus on? I want you to focus on just a couple things. Okay, and so I want to focus on hematocrit, VE, capillary density. Don't worry so much about cerebral blood flow or HIF1. Okay, HIF1 is just a protein that is activated in hypoxia. Okay, so just a quick refresher. Initially, we have an increase in ventilation followed by a slight decrease, and then when we acclimatize or over chronic exposure, that ventilation gradually increases over the next several weeks. Okay, at the same time, hematocrit goes up. Okay, and this actually is activated pretty quickly, but we really don't see the full effect for several days. It takes several days to produce new blood cells. And the other thing that happens, and that's with this gray line here, is that we increase the number of capillaries in our body. Okay, so acclimatization is something that's kind of progressive, and the longer or the higher you are in altitude, the longer it takes. So really, to experience some true acclimatization, 2,300 meters seems to be kind of the big thing. So higher than most places in the U.S. where people live, where a lot of people live. But notice that you get to this point around 5,800 meters, around 20,000 feet, you never acclimatize. Okay, it just does not happen. And so there are very few people that live at this altitude. I can't remember what the highest town is in the country or in the world, but I don't think it's close to that, but I don't think it's much higher than that. So when it comes to hypoxia, ultimately what happens is we don't have enough oxygen. We're not able to deliver enough oxygen. Remember, delivery is content times cardiac output. With content, we're worried about hemoglobin concentration and saturation. With content, it's cardiac output, heart rate, and stroke volume. And really, it's making sure we get the blood where it needs to go. So to start this all off, we need to do what's called, or protect alveolar gases. This is one of the challenges that we talked about with the respiratory system several weeks ago. Okay, so carbon dioxide, alveolar carbon dioxide, is essentially equal to the amount of CO2 or the volume of CO2 you're producing divided by your alveolar ventilation. With alveolar oxygen, it's a little bit similar. It's how much are you taking in minus the ratio of VO2 to alveolar gas. The problem is, how do we maintain both alveolar oxygen and alveolar CO2? Okay, so that's what we're trying to figure out. So we come back to this same equation. Let's worry about content. Specifically, let's focus on hemoglobin. Okay, so with hemoglobin, there's two adaptations. One, plasma volume is reduced. Now, as we talked about last time, and at the beginning here, when you increase your ventilation, you're getting rid of CO2, which should be fine. But the problem is CO2 is an acid, and so by getting rid of this acid, we become alkaline. Okay, and in order to counteract this alkalinity, we need to get rid of bicarb. And the way we do this is through urination. Okay, and so we increase our urination to decrease our bicarb, and this also has kind of a secondary effect. That reduces our plasma volume, and what it allows for is a higher concentration of hemoglobin, right? We're taking water out, and so now we have more hemoglobin per unit of water or plasma volume. The other thing is that we create more blood cells. Okay, so EPO or erythropoietin is the hormone that stimulates the production of red blood cells, but in order for this to occur, you have to have enough iron. Okay, and especially for women, this can be a little challenging. They're generally iron deficient or on the low end of iron because of the menstrual cycle. All right, and so if you look at this figure here, notice how red blood cell volume and hemoglobin concentration, how they're all related. So initially, we have a drop in plasma volume, and this is due in large part to just that increased urination to counteract the respiratory acidosis. And so as a result, our hemoglobin concentration goes up quite a bit, but we don't have the same, it's not to the same degree as our red blood cell volume. Okay, but this plasma volume decreases blood volume, and then over time, it gradually increases, plasma volume increases maybe a little bit, but our red blood cell volume increases, and that will also increase blood volume. Okay? So the next thing is that hemoglobin saturation. So how can we do this? Well, as we talked about last time, by hyperventilating, we actually cause a left shift. Okay? And one of the other things that can happen too is there's this activation or this production of something called 2,3-DPG. Okay, this is a molecule that can bind to hemoglobin. And basically what it does, or the way I like to think about it in its simplest terms, is that it takes a spot or makes it more difficult for oxygen to bind to hemoglobin. So when we have 2,3-DPG, sometimes you'll see it as 2,3-BPG, it makes it more difficult for oxygen to bind, and so it reduces the affinity of oxygen binding to hemoglobin. Okay, so while that sounds bad, you can also look at it this way. What are we doing better? Are we making it easier to load or easier to unload? So initially, when we first get to altitude, we have this ventilatory or respiratory alkalosis that causes that left shift. Okay, that left shift makes it easier for hemoglobin and oxygen to bind in the lungs. But as we go over the next several days, weeks, we're getting rid of bicarbonate, okay, which is going to counteract that ventilatory alkalosis. It's going to reduce our pH, okay? That makes it easier for oxygen and hemoglobin to break apart. And then also you have this 2,3-DPG. Same thing. It makes it easier for oxygen and hemoglobin to break up. Next, we have, blood flow, and specifically regional blood flow. Okay, and so we need to become better at utilizing oxygen, be able to better take it up. And so we can do this several ways. All right, we can increase the number of capillaries we have. We can increase the amount of myoglobin, and we can also increase the number of mitochondria. But these take a lot of time. This isn't something that you experience in a month, a week, a day, that sort of thing. These adaptations take quite a bit of time, so up to a year. All right. So perhaps the biggest thing is, how does this affect VO2 max? Okay. We're not really talking about anaerobic performance because altitude, I'd get rid of some oxygen. If I'm relying on anaerobic or systems that don't use oxygen, that's not a big deal. Okay. And so it kind of depends on what you're doing. If you're at altitude, just hanging out at altitude for a while doesn't really change VO2 max. However, as you become acclimatized, you're going to improve your time to exhaustion. That's what TTE is. So it's basically how long can you go at this intensity for? Your time trial, so how long does it take you to cover a specific distance? You improve both of those, but this is talking about performance at altitude. So if you did a test at the beginning and then you did a test several weeks later, you're going to have better performance after acclimatization. However, at sea level, acclimatization doesn't really seem to help VO2 max or aerobic performance. And there's an important reason why. Okay, so we've got on this axis, we've got a couple of things. So we've got altitude benefits, and then we've got fitness. Okay, and so from here to here, we're at altitude. Now notice what happens to our fitness. It decreases. But our altitude benefits are increasing. So think of this like we're increasing red blood cells, we're decreasing plasma volume, we're, all these other things. Well, why is our fitness going down? And the reason being is you aren't able to train at the same intensity at altitude that you are at sea level. Okay, your body's just not able to bring enough oxygen. So as a result, your fitness decreases. All right, and so what happens, though, is if you go back to sea level, you lose these altitude benefits and you gain your fitness back. Okay, and so the question is, how can you account for both of these? So with exercise intensity, just to say this in words or to see it in words, there's less oxygen, which means your training intensity will be decreased. As a result, those fitness decreases are offset by your increase in oxygen delivery. And so to maximize to maximize things, you need to somehow figure out a way to experience altitude while also maintaining training intensity. And we'll talk about that in the next and last and final video of the semester.